Alright, Ken, on the main menu, I'm going to go to my initial exam for a chief complaint for this patient that began today for an initial report. I'm going to say that he has a chief complaint of upper back pain, which is rated a scale of 1 with 50% frequency. The maximum is an 8. And he felt that last of maximum yesterday. He has this pain daily, and it is dull, achy, and throbbing. It radiates into the right shoulder, and there is stiffness associated with this area. Going back, I'm saying it is aggravated by, does standing aggravate it? No aggravation with standing. The next question is, does walking aggravate it? It aggravates the upper back pain after 20 minutes. Does sitting aggravate it? It aggravates the upper back after 30 minutes. And bending has no aggravating factors. And going to palliative, it feels better with rest and sleep. Going to next. And I'm going under etiology. The etiology for this, it began yesterday, and it is unknown. From there, we go over past medical history. Past medical history denies any broken bones, denies any surgeries, denies any traumas, and he has no children. The patient does not have a pacemaker. The patient does have diabetes. And going under general health, the patient has tuberculosis, asthma, he's had a heart attack, let's take out the TB, and has migraines. This is not a female that is pregnant, and if it was, the due date would be there. Family medical history, the patient has history of heart disease and diabetes. And under medication, was told to bring a list. The patient does or does not smoke, and I'm not going to put in what they do as far as their work history. I'm going to go back to my main menu. I'm going to objectives. I'm going under initial objective. He presented to my office with a normal gait. His vital signs are: introduction, the patient presented for vital signs. His height is going to be 5 foot. He is 2 inches on top of that, weighs 150 pounds. I got this from a scale, and I took his blood pressure. His blood pressure was 120/80, and his pulse was 16. From there, I went over his respiratory rate, which is 16, and then it was within normal limits as far as the way he breathed. His temperature was taken by the ear, and it was 98 degrees. I'm not going to go over his BMI. I'm going to go back to objectives. Review of systems, detailed review of systems. The patient has no problem with their vision. Go down. The patient has a decrease in hearing. The patient has a decreased sense of smell, has acid reflux, has no problem with voiding solid or liquid nutrients, has asthma, does not have any chest pain associated with that, does not have any skin rashes or irritations, does not need a mammogram, and the patient has a recent PSI, and the test was normal. From there, we're going to go out of review of systems. We're going to go over our orthopedics. Let's just do one cervical orthopedic positive foraminal compression in the neutral position, and it hurt the upper back right there in the middle. We're going to go out of orthopedics, and we're going to do some reflexes on this individual. We're going to do reflexes. I'm going to do the upper reflexes. They were all normal. And we're going to get out of reflexes and go under muscle testing. The upper extremity tests were all normal. We're going to go out of there. We're going to go under visual range of motion. The thoracic spine had restrictions, moderately with flexion and mildly with right rotation, and no restriction with left rotation. He had pain with no pain with all thoracic ranges of motion, so I can skip that one there. When we come out of ranges of motion, we're going to go back to visual assessments. Scars, burns. Nope, no burns or scars. We're going to go under palpation. They had tenderness in the thoracic spine at T3, T2, T4, T5, and go to next. And from there, they had muscle spasms here, 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 and here. We're going to go to next. Levels of subluxation, we have T2, T3, T4, and we're going to go to next. Is edema noted? I'm going to skip that one and go out of palpations. We're going to go to radiology findings. I don't have the thoracics done yet, but if I go under radiology, I can say that he had an x-ray taken today. I can say that the following x-rays were taken, and I'm going to put in cervical even though it was probably a thoracic I would have done. From there, we're going to go under x-ray findings. From the x-ray findings, we take a 2-view. From here, we have down that the patient has a decreased curvature. He has an anterior listing between C7 and C1. From there, we're going to say that George's line is intact. There we are. We're going to say that there was no break in George's line. Vertebral body heights are decreased at 2 and 3. We're going to go over the ADI space is benign. We're going to say that the intervertebral disc spacing are decreased between this and this level here. We're going to say that there is degenerative disc disease from here and here, and we're going to call that moderately. From there, is there anterior exostosis? There is not anterior exostosis. The level, there is none. Is there or not posterior exostosis? There is posterior exostosis located between C2 and C3. There are anterior exostoses noted between 3 and 4, 4 and 5, 5 and 6. There is not left foraminal exostoses noted. And then from there, we can skip that one. There were no fractures noted. Skip the fractures. No soft tissue lesions. Skip that one. Artifacts were noted were earrings, and additional comments were none. That is an exam.